Hello, I'm Christopher Watson, founding director of the Reflective Practice Center at the University of Minnesota, which is a program of the Center for Early Education and Development. I'm also co-author of the RIOS research tool and the RIOS Guide to Reflective Supervision and Consultation. The story of the RIOS began at a meeting in Scottsdale, Arizona in 2010, sponsored by the Alliance for the Advancement of Infant Mental Health. At this meeting, 50 leaders from across the country came together to identify and better understand the active ingredients that made reflective supervision such a powerful professional development process. We also wanted to demystify reflective supervision so that when we spoke to those who were not familiar with it, including policymakers and administrators of programs, we could better articulate both the process and the outcomes of reflective supervision. So at the meeting in Arizona, we divided into small groups, 5 small groups, and watched videos of reflective supervision, writing down what we saw and heard. Then we came back to the large group of 50 people and put those findings together and came to consensus about 18 behaviors and qualities that we saw in the reflective supervision relationships that had been recorded. Following the meeting, we sent that information, those 18 items, out to other experts around the country for their further feedback. Then during the next 8 years, a subgroup of the folks who met in Arizona held monthly calls to discuss what we had found, the framework that we were starting to develop, to put the pieces together in a way that made sense and that we could all agree upon. Following that 8 years, our Minnesota team did further refinements on the research tool and then tested it in several studies, including one that validated what we had put together. During this whole process, we were talking to other people about our work, presentations at conferences and meetings, and informal conversations with colleagues, and found that a lot of people were interested in using the RIOS framework in training others and in their own work to think about how they were providing reflective supervision and tracking what they had accomplished in working with their supervisees. This led to publication of the RIOS Guide, and our work with the organization 0 to 3, our publisher, happened to be delayed for some time actually, which turned out to actually be an advantage in that we were able to update the RIOS framework with particularly strengthening the focus on diversity, equity, and inclusion. Our hope is that both the RIOS research tool and the guide will help increase the number of professionals who are both supported and whose skills are improved through reflective supervision.
Hi there, my name is Deb Ottman, and I am the Professional Development Coordinator here at the Center for Early Education and Development, otherwise known as CEED, based in the Twin Cities at the University of Minnesota. I am also a team member of the Reflective Practice Center based at CEED. And in these combined roles, I've had the great good fortune of watching the RIOS be introduced to the field of early childhood and specifically infant and early childhood mental health as a research tool used to help us understand and describe What happened during this reflective alliance that is forged during reflective supervision or consultation, and almost simultaneously with the introduction of this research tool, watch it become a job aid. And I think the reason this happened is because it so beautifully and elegantly organizes these different essential elements of reflective supervision and consultation into a framework that is easy for people to understand, and also for people to recognize as having great opportunity to enrich, deepen, and extend this professional development practice of reflective supervision or consultation. And so in response to seeing this as a valuable opportunity for professional development for all practitioners, and from people who are in direct service all the way on up to administrators and leaders, we here at CEED developed a couple of different vehicles for professional development. We have developed 2 online asynchronous instructor-led courses that focus specifically on the RIOS as it relates to reflective supervision and consultation. It introduces people into what the framework looks like. And in our second course, they have the opportunity to really take each essential element and look at them more deeply and specifically. We also developed a series of self-study modules that have as its through line not only the essential elements and collaborative tasks that the RIOS uses within its framework, but also many of the infant and early childhood mental health principles upon which the RIOS takes its cues from. And so these self-study modules also offer people a different route to being able to more deeply examine and think about how these different essential elements are brought into the interactions that are experienced during reflective supervision and consultation, and how they themselves come to this professional development activity. And in all instances, I'm just delighted to be a part of introducing the greater field to the RIOS, and hope that you find it as useful and worthwhile as we here at CEED do. Thank you.
Hello, my name is Alyssa McMahon, and I'm a research associate at the Center of Education and Early Development here at the University of Minnesota. And I have sort of been in charge of the research aspect of the RIOS. When I started here in 2017, Christopher and Martin and I did a lot of the first coding of videos. They had kind of developed the RIOS, they had a manual. That was really the moment where we were just starting to code the videos and say, how does this work? How can we actually agree? How can we explain it in a way that's going to make sense to more people than just us? And so that was a really fascinating process of refining the coding so that it could be used in research. And since then, we've trained 7 people here at the University of Minnesota to be reliable coders, and also have trained a number of different collaborators at different universities, Georgetown, Sonoma State, the University of Nebraska-Lincoln, also someone at the Alliance for the Advancement of Infant Mental Health. We got a project this spring coming up where we're going to be working with some researchers at Brown University as well. And so it's been so interesting to share this tool with other people who have different kinds of videos and different projects and see how it applies to them. They always have new questions that come up. And so it's been a really interesting process of refining the tool and making sure it's really clear about, what scores mean what behaviors and things like that. And from all these projects, we've learned a lot. I think one thing we've learned is that the process of reflective supervision is complex and not straightforward. It also is true that it's really a dyadic measure. And so if the dyads change, if there's a lot of attrition over the study, that complicates the data a lot. It looks a little different in terms of measuring change if people are just starting versus if they're really experienced. The change is not always linear anymore. And it's a little bit fluid and capturing some of that complexity. So I think in some ways that's been great to see that we can really show something that's a complex process, and also just makes us think really hard in some of these research projects about what we can do with this data. We've also learned that we do have some correlation and validity with existing self-report measures, specifically around the use of self and the reflective alliance. And so there's some self-report surveys that measure sort of how you feel about your self-efficacy, how you feel about your reflective supervisor. And so that was great to see that we're aligning with some of those measures, but then also that the RIOS is adding other pieces, like understanding the family story, holding the baby in mind, parallel process, that maybe weren't really being captured in a lot of the surveys that were being used frequently in this type of research. So I'm really excited that this book has launched and is in the world. I think the research has informed this practice tool, and everyone who practices it will continue to inform the research. We're always excited about new research ideas. If you have videos, if you know people who are doing projects, there's still so much to learn. We haven't used the RIOS very much with very diverse populations. We haven't collected really usable data on even just a lot of people. And so we are sort of still really building up this tool and what it could be and how it could help the field.
Hi, I'm Sarah Fitzgibbons, joining you from Rochester, New York. I serve as the Vice President of Programs and Practices at the Society for the Protection and Care of Children, SPCC. Our organization has about 130 employees and offer prevention and intervention programming to infants, young children, and older children and adolescents and their families. We focus on children and families impacted by trauma, loss, adversity, and separation related to child welfare and high conflict custody. I am so excited that the RIOS guide is here. We have been waiting at our organization and know that this will be a tremendous tool moving forward. Since 2018, we have been on a journey to infuse reflective supervision and reflective practices at all levels and in all supervisory relationships at the organization, from our IT manager, our HR director, our front desk staff, me as a vice president, of course, our direct service practitioners, and everyone else in between. We know that the RIOS has been a great tool, and this book, this guide, will be a tremendous one moving forward. So one of the things that we have been doing with the RIOS is using the RIOS in its most traditional form over the iterations, of course, with supervisees who provide direct services for infants, young children, and families, and have found that to be really helpful as we've trained all of our supervisory staff in the RIOS. They have found it really helpful as a way to operationalize reflective supervision and as a way to be tracking their comforts and growth areas. One of the other things we've been doing, though, is thinking about using the RIOS as a launch pad, that the concepts related to the elements and tasks, that reflective alliance, and thinking about how to translate that for supervisees who don't do direct service, maybe now in their role, like me. So I could certainly tell you stories about and examples of how we've been doing that across different roles and how different people have been sort of using the RIOS to translate. But I thought I would share with you just a little bit about myself as an example and how my supervisor has been using the RIOS to help me think about my work more deeply. So we have been thinking about understanding the family story. My part of my role is working across systems and across organizations in the community to increase infant early childhood mental health professional capacity. And so doing so means lots of relationships with lots of systems and people in those systems and big systems and small organizations. And for me, understanding the family story has helped me figure out how I can best be and serve. So instead of seeing the family as we traditionally would, when we're doing direct service work, I have been thinking a lot with my supervisor about the family being comprised of our professional community, our professional 0 to 6-year-old serving community as the family, thinking about our community and our city's history, from the rise and fall of Kodak to Susan B. Anthony and Frederick Douglass, to purposeful and systemic racism practices like segregation of housing, to current power dynamics at play, funder relationships, trauma in our system and community's history, growth, present day stressors and opportunities, thinking about who the family members are, and particularly what the ghosts and the angels in the nursery of our professional community family is. And so thinking about understanding the family story through those tasks of describing and considering why it matters, how I and others might think and feel about a particular dynamic in our community collaborative efforts has been very helpful in the way I can integrate those reflections and step into refreshed or renewed, trauma-informed, culturally responsive ways of being in my cross-systems collaborative work. So that is just one way that for me, the RIOS has been so helpful, and one example of a way that our organization has been thinking about using the RIOS across our whole system for the support of our staff. Thank you for having me, and congratulations.
Hi there. My name is Chris Amaralt. I'm school director here at Tulsa Educare MacArthur, one of the 4 Tulsa Educare schools in Tulsa, Oklahoma, and I am thrilled to be talking with you about RIOS. We've been part of this project for quite a while and have benefited from RIOS in so many ways. Of course, in our field, we try to focus in early childhood on keeping that baby at the center, really thinking about the family story with a deep sense of respect and curiosity. And those are 2 features of our Early Head Start program here that we've always embraced. But RIOS added certain other things that have been incredibly powerful in our work. The 2 that I wanted to mention are professional use of self. We focus a lot on mindfulness. That's been particularly important the last 3 years. And as we do, we have to recognize that sometimes we don't show up the way that we might want. We spend a lot of time talking with our teachers about this, with our family advocates, with my leadership team. And in all of those conversations, we try to recognize that we have choices that we can make about how we do want to show up and how can we use who we really are in a professional manner that promotes the work that we do. The reason why this is so important is because of parallel process. Parallel process in my building, well, we talk about that. How we are is so important, and in some ways is much more important than what we actually do. The idea that each of our interactions builds culture, positive or negative, has become part of the way we do literally everything in the building, and it's part of the way we do leadership development. I think RIOS is an extraordinary tool for leadership development, and we've been using it a lot in parallel with our other projects. It's become part of the vocabulary that we use to think about these reflective alliances where we're interacting with each other and trying to support and promote each other, and at the same time take those next steps in our own development. It's been a great, great project for me to be involved in. I'm so thrilled and excited to look forward to the book, and I hope that everyone else is enjoying this wonderful moment of celebration. Thanks for having me be part of it.
Hi, my name is Katie Lingress, and I am an associate professor in the Department of Psychiatry and Behavioral Sciences at the University of Minnesota, Twin Cities. And I wanted to offer just a few comments in terms of how this work has been particularly helpful, and the RIOS in particular has been particularly helpful for me in some of my work. So some of you may know that I published an article last summer in the Infant Mental Health Journal called Mind the Gaps, and it was an article discussing the use of reflective supervision and consultation as a mechanism for addressing implicit bias and reducing our knowledge gaps. And so I wanted to tell you a little bit about the story behind this article, because it's been kind of a work in progress and a passion project of mine for about five and a half years or so. And the idea first actually came to me when I attended the Reflective Supervision Symposium in 2017. And that was some of my first exposure to the RIOS itself and the in-depth work around reflective supervision, despite having participated in it for many years. So when I discovered this framework, it really got the wheels in my head turning around how can we use this framework to really think about bias, and how can we incorporate conversations around bias and diversity, equity, and inclusion into our work in mental health. So when I remember specifically sitting with a handout that delineated the different aspects of the RIOS, and it was like a light bulb went on in my head to sort of see the connections between the different domains, kind of lining up with a lot of the things I had been thinking about in terms of how we can expand our conversations related to bias and DEI work within supervision. So what really helped me about this process and this framework itself, the RIOS, was that it gave me a framework. It gave me a way to organize my many different thoughts, and it helped a lot to have something to work from. So knowing that there had been all this work and this research going into this tool was really helpful for me to be able to take that and kind of move it to the next level. And I think that's one of the things that the RIOS and frameworks like it brings, is that organizational structure to lots of different ideas. And so with that structure, that really allows us to move forward in the conversation about what this might look like in supervision, to incorporate more conversations explicitly about reflection on diversity, equity, and inclusion, our own identities, our own human biases, etc. And so ultimately, my hope, and I know that the team shares this hope as well, is to think about how we can use frameworks like the RIOS to engage in this conversation and then ultimately affect practice and affect change across our mental health field. And so I think that this framework is particularly helpful in thinking about, both for supervisees and supervisors, how we bring those pieces of the conversation together and then put it into practice, even in our supervision, thinking about specific activities, specific tools that we can use. And then by extension, going forward, we know that this will in turn affect our practice within mental health across different disciplines.
Hello, my name is Faith Edson, and I serve as the Reflective Supervision, Consultation, and Clinical Initiatives Director at the Alliance for the Advancement of Infant Mental Health. The Alliance offices are in Michigan, and that is also where I live. I first want to send a hearty congratulations to the RIOS authors and contributors for this long-awaited launch of the revised RIOS guidebook. We are enthusiastically celebrating with you. The Alliance community, which consists of infant and early childhood mental health professionals from across the world, has both contributed to and benefited from the extensive work done with the RIOS to operationalize a relational process that is sometimes described as simply magical. While many of us can describe the felt experience of a reflective supervision relationship, the way in which we know it has transformed and supported our work with babies, families, and supervisees, we often fall short of helping others who might be new to the concept understand exactly what it is. We just know it works. But what are we doing in reflective supervision? How does it work? And how do we know if what we are providing, receiving, or observing is reflective supervision? The RIOS framework has given us a concrete language and observable behaviors to anchor our understanding and ground us in the power of relationships. Currently, the Alliance cites the RIOS and outlines the 5 essential elements in our resource for the field entitled Best Practice Guidelines for Reflective Supervision and Consultation. We also include RIOS content in the training we offer, and we find that providers of reflective supervision appreciate the clarity and structure inherent in the essential elements and collaborative tasks. We receive feedback that providers are able to immediately practice the skills they learn through the study of the RIOS. Over the past few years, we have heard from numerous infant and early childhood mental health leaders who are not providing direct services to children and families, but who are interested in the benefits of reflective supervision and how they might utilize it in their roles. Currently, very little is written about the application of reflective supervision for systems leaders. The Alliance, along with our partners, has identified a need to expand reflective supervision language and training to include applications and examples specific to program. Coming year, we look forward to collaborating with CEED to broaden the RIOS language to meet the needs of this important sector of the workforce. I have no doubt that this expansion of the framework will be welcomed and celebrated across the field. Finally, thank you to my dear colleague, Christopher Watson, and to CEED for inviting me and for your ongoing collaboration with the Alliance. It is an honor to be working alongside you on behalf of babies, young children, families, and the dedicated workforce serving them.